Ashley Jetta Garcia is the CEO and founder of AJG LLC, has experience in the following fields: information technology, legal, security, safety, investigations, and project management, all of that since 2005. She has worked in the private sector for Fortune 500 and 100 companies, as well as in the public sector. She has started working in the insurance industry in 2018, so she's been in that industry for a long time. Ashley is a Colorado native and a double alumni at Regis University with 3 degrees and 2 bachelor's degrees of science in mathematics and business administration, with an emphasis in international business and a master's of science in criminology. Wow, you're so educated. It's amazing. I love all these things that you've done. She has completed all the required courses and examinations for a PhD in forensic psychology. So pending that last piece there. Ashley strives to enhance her understanding of different marketplaces by leveraging her traits as a dependable, well-rounded, organized, business-savvy, complex, problem-solving mathematician. Ashley, take it away.
And with that, we're going to talk about health insurance because that's really important. And let's just get into it so that we can all understand a little bit more about it. So that everybody understands, again, my name is Ashley Jetta Garcia, and I am with AJG LLC, and we're giving a little bit more information on health insurance today. Just a disclaimer, this is 100% all educational purposes. You would have to make an appointment with me, so you can text BNI APPT to 720-775-7358, or you can schedule an appointment at apt.ajgllc.com to get more information on your unique needs and wants within the health insurance industry. So let's start off by understanding a little bit more about the cost of insurance and what it means to have insurance. First and foremost, we have a premium cost. This is the amount of money that you would pay to just have an insurance policy. We have your annual deductible. This is the amount of money you would pay for covered medical services in a calendar year before the health insurance company that you choose will pay for their portion of your insurance policy. And then we have your max out of pocket. This is the most amount of money you'll pay in 1 year before you won't have to pay anymore except for your premiums for the rest of the year. And then we have your copayments, which are set dollar amounts for covered services, and coinsurance, which is a percentage amount for covered services. And just so everybody understands, covered services depend on the insurance plans, and we're going to go a little bit more in depth on the different marketplaces. So first and foremost, I don't like using this word, but I couldn't figure out a better word. There are several different government-approved insurance policies. So first and foremost, we have on-market exchange policies. These are for under 65 individuals. And depending on where you live depends on what type of marketplace you'll be in. So if you are in several states, there is a federal marketplace, or there is also a state marketplace depending on the state. So for example, in Colorado, we have a state marketplace. And then in addition to that, there is also an employer marketplace. It's called the SHOP. And this is for employers who have between 1 to 50, and some states will go up to 100 employees. And you can create something through the marketplace for your employee and employer sponsored plans, okay? And then you also have Medicare. This is for U.S. citizens or legal residents who have lived in the United States for at least 5 consecutive years and are at least 65 years old, or are under 65 and have a qualifying disability or special situation. Within the Medicare space, there are 4 parts. There's Part A, which is hospital insurance, Part B, which is medical insurance. Some option is Part C, which is an advantage plan, and then there's Part D, which is prescription drugs. In the on exchange, it depends on what state you're in. There are many different qualifications in various states, but most of them will have things like pediatric services, your doctors, your specialists. All of them will have prescription drug coverage, and then there will be variations for like emergencies and other things of that nature. So then we also have other insurance on top of that, okay? Other insurance is off-market plans. The best thing to know and understand is if you get a form IRS 1095 or something similar, then you know if your insurance plan is qualifying within so that you don't have to pay taxes or anything of that nature if that ever comes around. And so with that, there's the individual side, and then there's also group plan. With group plans, you just there's various qualifications that you want to meet to have your credible coverage within a group plan. And then we also have supplemental insurance. These are just add-ons to insurance that you would already have. Okay. So this is dental insurance, vision insurance, hospital indemnity, cancer. And then I'm not sure if a lot of you have heard of this, but there is something called life insurance with living benefits. And so that can be added on as an additional coverage for you. Just so you guys understand, there's various different companies that I represent and various different states that I'm in. So in the Medicare space, some of my stuff will line up with Ryan Merchant Associates, and then others I am direct within various different companies as well. And so I got a lot of questions about how to select insurance and how to pick and choose the right plans. And so with that, let's understand some questions to ask yourself to be able to understand a little bit more about insurance. So first and foremost, what is your budget? And when I ask the question, what is your budget? I don't mean, can you afford your premiums? Because if you can only afford the premium for the plan, then that means you can't use the plan. So there's certain ways of structuring your plan so that you are able to access everything within the plan and be able to afford what you have. Okay. Do you qualify for tax credits, tax deductions, or anything of that nature? There are various different options available within the individual and group plans and employer, because there's business owners, there's various tax deductions, but you have to understand and know what those are. And it all really depends on your scenario and your situation and how you want to structure your business for yourself and everybody around you. And then another question is, what doctors do you want to go to? Some people have a hard decision on understanding that they want to see this doctor no matter what. And so they will pay any cost to see said doctor. And so with that, we want to make sure that we choose a plan for them so that their doctor stays in network. But the caveat to that, and I want you guys all to know this so that you're aware, is that a doctor can go in and out of network at any time throughout the year, and that doesn't create something for you to be able to change your insurance. Okay. So that's something to always be looking out for and understand. And then something that's really important that I personally think is important is, what prescriptions are you taking? Because you want to make sure that your prescriptions are being covered by your insurance company. Otherwise, you can lose access to those prescriptions if you change a plan, and then they're not on this list. It's called the formulary list. And then, of course, really important, especially for business owners and entrepreneurs, do you travel? And how does that look within your insurance realm? And what if you have an emergency? What do you do so that you're prepared for that if you are traveling? And then, of course, what do you usually spend the most on in regards to insurance? So let's say that you don't ever see a doctor, you never take prescriptions, but you always have to go to the dentist, and you always have to you go and see your eye doctor all the time. Those are things that we would look at to supplement what you already have, so that we are making sure that you're being able to access what you need and what is most important to you. All right. With that being said, I'm going to do this slide again because I think it's really important no matter what. First and foremost, we have various different times to pick your plans. In the individual marketplace, it's the open enrollment. So remember, this is under 65. You have from November 1st through to December 15th, and then that change during that time period will go into effect January 1st. Okay. There are some states that do extra open enrollment time and things of that nature, but the effective date is January 1st. If you want the cutoff for January 1st is December 15th. Okay. And then you have your special enrollment periods. This is 60 days from the day of the occurrence. Okay. And this is when you have a lot of health insurance, change in your household size, permanent move, or if you become eligible for various coverages or have an enrollment error, things of that nature. Okay. And then on the Medicare side, you have various different timeframes when you can do your insurance. First and foremost, you have your initial enrollment period. That is when you turn 65, 3 months before, 3 months after, okay? You have your annual enrollment period, which is October 15th through December 7th. Then any changes during this time period go into effect January 1st. And then if you end up selecting during the annual enrollment period a Medicare Advantage plan, then you have an open enrollment period during January 1st through March 31st, where you can change your plan once during that time frame. And then the following month, that first of the month is when it would start. And then, of course, there's special enrollment periods. This is a 2-month-ish period, okay? So retiring, moving, receiving assistance, or diagnosed with certain disabilities or chronic conditions. With that being said, I need you guys to make appointments with me so that I can look at all the stuff that you guys have for your unique scenarios, because I know we had a lot of questions on the best plans for everybody. And I can't answer that without knowing a lot of information. And it's not a lot. You can ask Dale. It takes like 15-20 minutes. And then I can look and figure out what to do best for you. And stuff that I would need before the review is knowing your current doctors, your prescriptions, and if you have preferences on various insurance companies that you want to use, people that you want to use, things that you want to use. And that's pretty much where we're at. So I'm going to open up for questions. Any questions, comments, concerns?
Now for Medicare, it's when you hit 65, you have to get Medicare. You can no longer get the other marketplace or the other insurances. You have to have Medicare. Is that correct?
So yes and no. It is correct if you are on the exchange. If you are in a group plan, no, you don't necessarily have to elect for Medicare. You would just normally elect for Part A if it's free for you. If it's not free for you, then we would look at options on figuring out how to get it, how many more years you'd have to pay into Medicare to get it free before you can do that. And then in addition, if you have an employer who's paying, then it depends on if you're going to save with them or not to elect for all of your Medicare Part A and B.
Okay. My dad's coming up. We'll have him set an appointment with you.
Anyone else? Beautiful. Thank you, everybody, for coming out and learning more about health insurance. And of course, come visit our BNI Rocky Mountain Elite chapter. You can go to www.bnirme.com and visit us at any time on Thursday mornings at 7:30 on Zoom, and it's Mountain Time as well.